I'm pregnant. What can I do to prevent diastasis? Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and certified birth healing practitioner. This is a great question. If you are currently pregnant or planning to get pregnant, you may be wondering, how can I prevent diastasis? Well, let's first talk about the simple fact that you can't prevent diastasis. It's actually a normal adaptation to pregnancy. I want to talk a little bit about what diastasis is, and then go over some tips that you can use during pregnancy to help your body feel confident and for you to have a smoother pregnancy and birth. So let's talk about what diastasis is. And I do want to reassure you that it's going to happen 100% of the time. It happens to some degree during pregnancy. And so the goal really isn't to prevent it. I'm going to show you this illustration here. I do have permission from Pelvic Guru to use this illustration, but this just gives you some representations of different types of diastasis. So in a nutshell, diastasis or diastasis recti, diastasis recti, you'll hear it pronounced different ways. It's all the same. Is basically the right and the left sides of the rectus abdominis muscles, like those six-pack ab muscles. There is a connective tissue, a really thick connective tissue between the right and left sides called the linea alba. Well, during pregnancy with growing baby that tends to grow forward, right, a little bit to the outside, but that puts a lot of strain in this linea alba, and it creates a separation of the right and left sides of the muscles. So you can see here in this illustration, this is actually an abdomen without a diastasis. You can see how that's together, and there's no separation. Then we can see here just different variations. There can be a diastasis. This is what I see most often, is a diastasis right along the belly button, because that's the biggest point typically with mama, that the baby's going to create the most strain right at the belly button, okay? But then it can happen either above or below that, or even along that whole length there. So that gives you a little bit of a view of what diastasis is, okay? So again, we're not going to try to prevent this, but I want to give you some tips that can help your body and help you feel more confident during pregnancy. So I'm going to go over 3 tips that you can use during pregnancy. Number 1 is learn how to engage your core and your pelvic floor. Those are the muscles that are going to give you the support, kind of like a corset effect, in order to give you the support for your back as well as baby and for your pelvis during pregnancy. Tip number 2 is don't be afraid to move. I see a lot of women that get fearful during pregnancy that they're going to do something wrong, that they're going to make things worse, especially with a diastasis, for instance. However, I don't want you to be afraid to move your body. So going back to tip number 1, if you know how to properly engage your core and your pelvic floor, and you're going to give your body that support, there shouldn't be a reason why you can't do the things that you need to in your everyday life, like pushing, pulling, carrying, lifting, and also exercising. Okay, I want you to have the confidence that you need in your body in order to continue to move and to continue to exercise, including weightlifting and doing some cardio exercises. I think there's a lot of benefit in staying active, not only physically, but mentally and emotionally. With that said, I want to let you know if you do notice anything, what we call like coning and doming. So going back to this illustration, if you do have a little bit of this separation, you may notice like a tenting or a coning or doming of that separated tissue. Okay, you might notice it when you're getting in and out of bed, for instance, or if you are doing some kind of exercise and you look down and you notice that. What I want to say is we don't want to cause that. We certainly don't want to do something that's intentionally straining that area. So if you're noticing that, I would really encourage you to modify your exercise. So for instance, if you're noticing it when you're lifting your head to get up out of bed and come to the side of the bed, what I would suggest that you do, instead of kind of jackknifing up out of bed, is roll to the side and then sit up to a sitting position before you go to stand up. So that's a good way that we can support the body, modify the activity so that we're not causing that strain. My third tip for you is to pay attention to the backside. A lot of women are so focused on the belly and the front side that they actually don't know that they have a lot in their control when it comes to the back. So So let me explain what I mean by that. If we go back to this illustration, we come here to this abdomen without the diastasis. Think of that linea alba almost like a zipper. If I had a jacket on and I had a zipper there, that's keeping both sides together, okay, keeping this closed. Now, some things that constrain the zipper is tightness from the back side. So think about your growing belly here. And a lot of pregnant women get so tight in the sides and the back. So what if by paying attention to that, it could really cause less strain into the front? So what I mean by that is stretching into the back, doing maybe some child's pose or flexion, forward flexion type exercises or stretches, doing some rotational work where you're doing some opening up of this mid back. That can really make a difference to keep this limber here so it's not pulling and causing a strain into that front side. So I really encourage you to pay attention to your back and give it some loving. So if you're sitting there right now and you're thinking, okay, this is all great information, but I still don't know what to do. I don't know how to engage my core and pelvic floor. I don't know how to prevent that doming, what have you. What I would say is the next best step for you is head to my website. Let's have a chat. Let's book you in for a discovery session so we can sit down face to face and I can give you some reassurance and some guidance. The other option is work with me in a small group setting. You can also head to my website and go under the resources tab and check out my Fit to Be classes. It's a great way for you to learn how to engage your core and your pelvic floor during pregnancy, and I'll help you have a smoother pregnancy. Thanks for watching this Ed Talk. I'll see you on the next one.